Hello, and welcome to GAPNA Chat, an official podcast of the Gerontological Advanced Practice Nurses Association. GAPNA Chat provides interviews and discussions with GAPNA leaders and members of the gerontological healthcare community, and will focus on advocacy, policy, education, professional development, research, and clinical care for older adults. Before we get started, a practical guide for the gerontological specialist is now available for purchase in the GAPNA store. This text is a handy resource for anyone caring for older adults and is helpful to those preparing to sit for the Gerontological Specialist Certified exam. Visit www.gapna.org to get your copy. In this episode, Dr. Cassandra Von Ness, a gerontological nurse practitioner and member of the GAPNA communication team, talks with Dr. Karen Mack, the executive director at Nurses Improving Care for Healthsystem Elders at Rory Meyers College of Nursing at New York University in New York, New York. We are pleased to present Dr. Von Ness's interview with Dr. Mack.
Welcome, everyone, to our GAPNA Chat. Today, we have Dr. Karen Mack, the Executive Director of the Nurses Improving Care for Healthsystem Elders, or the NICH program at NYU Rory Meyers College of Nursing. NICH is a 350-member organization whose mission is to create age-friendly healthcare services for older adults. As the Executive Director of NICH, Dr. Mack oversees the growth and implementation of the niche practice model to improve health outcomes for older adult in care delivery settings, including hospitals and long-term care. She has led niche implementation at MedStar Health, a 10-hospital system in the Maryland and Washington, D.C. region for over a decade before coming to the niche program at NYU. Dr. Mack's nursing career spans 4 decades. She is a graduate of the University of Maryland School of Nursing with a BS in nursing and a Master in Science in Trauma, Critical Care, and Emergency Nursing. At the Carey Business School at Johns Hopkins University, she graduated with an MBA in Medical Services Management and received her Doctorate of Nursing Practice degree from George Washington University School of Nursing. She has worked for 2 decades as a registered nurse in emergency, critical care, and medical surgical care settings, and over 2 decades as an advanced practice registered nurse, including 2 recent years as the Senior Director of Nursing Excellence and Resource Management at MedStar Southern Maryland Hospital Center. She is board certified as an acute care nurse practitioner and critical care clinical nurse specialist. Dr. Mack is a recipient of the American Association of Nurse Practitioners Advocate State Award for Excellence. She's also received the American Association of Critical Care Nurses Circle of Excellence Award and the University of Maryland School of Nursing Francis Arnold Neurosurgical Nursing Award. Thank you, Dr. Mack, for joining us today. So, reading your bio, I see that you have had an opportunity to recreate yourself in a wide variety of nursing roles and settings. So if you were having a conversation with a 20-something Karen, what advice would you have about her future?
So thanks, Dr. Von Ness, for this opportunity today. I am a proud GAPNA member and look forward to networking with other members within the organization. I have 3 nieces that are BSN prepared registered nurses, and it's been my privilege to think about how career paths occur and guiding them and mentoring them. All 3 are now at the clinical expert stage in their mid-career. So if I was having a conversation with them or my younger, new to practice self, I think some of the lessons that I've shared with them have been choose your practice settings wisely. It's important to work somewhere where there's clinical care excellence, but it's also the quality of the work environment, It's great to be at organizations with cutting edge clinical practices, but the culture needs to be healthy in order for you to sustain your own personal growth. I also think nursing is a wide profession that allows nurses to reinvent themselves, like I've done over and over again, time and again. I always say to them, if you're happy in nursing, you need to look in the mirror because there's plenty you can do that will be a great fit. So it's a wonderful career and it's a wide career, but sometimes you just need to be brave and take a risk to evolve into a new subspecialty or role or practice setting. I think also to strive to learn from anybody in any practice setting. I've learned from leaders I loved. I've learned from leaders I didn't love as much, but everybody has something to teach you. And so some of the most valuable lessons aren't necessarily from the people that you have the most affinity with. So just remember to put lessons in your toolbox and you'll pull them out from time to time in your career, both clinically and from a leadership standpoint. I would say that nothing we do is ever wasted. It always comes back. There's always benefit. And so at least that's what I've found in my career. I think the other really important thing is professional organizations like GAPNA are very important for nurses to build their network, have side benefits of having friends and colleagues for life. Dr. Patricia Morton, who's the Dean Emerita at the University of Utah College of Nursing, who was the acute care NP-CNS program chair at Maryland, really emphasized that to me really at mid-career. Because of her influence, I became very active in the local chapter of a national professional organization. I'd also say, Niche is not a professional organization that has individual membership, but Niche has a number of features such as professional organizations do around collaboratives, community, developing shared resources. And so I'm excited to collaborate with GAPNA and also our niche community in terms of professional organizations, because I know they're so important for the lives of nurses and for their career progression and for the health of the profession as a whole.
That's excellent advice for any of us to take at any time in our career path. Working as an advanced practice nurse, you've had a couple of different roles. What clinical experiences have you had in acute care that really framed your heart for the care of the older adults?
I think, as an APRN, my focus has always been some level of population management, whether it was cardiology patients, whether it was pain management across the health system, geriatrics across the health system. Subspecialty practice has always been a passion. And certainly, in terms of my decade of cardiology nurse practitioner practice in Washington, D.C., I cared for a large subsegment of older adults in that population. The case for improvement of care for older adults grows stronger every year, and older adults are my friends and family. And so I want to ensure, a wonderful later stage in life experience for that whole population. In the near future, in the next few years, the number of older adults will exceed the number of children and teens in the US. We're about to cross the big divide. And so it's, that passion for care excellence and for older adult care, of providing the right amount of care. We know that too much care at times actually diminishes people's quality of life. And so having the right quality of care, the right quality of life is my passion in terms of the whole population of older adults. I also, in terms of my own family experiences, I've seen the gaps in care, opportunities for improvement. And we also know, what we saw was sometimes, when my mom's big concern, I recall when she was starting to have some early stage Alzheimer's, was that, people didn't talk to them. They talked to the other people in the room. And so having that sensitivity around older adults are adults, right? And so even if people have some mild cognitive decline, they are still their decision makers for a long time. And so sensitizing the workforce, sensitizing hospitals around treating adults, older adults as adults, making sure there's not ageism, working to combat ageism is another significant part of my vision and passion for this population. I became involved with the niche program when I was invited to join the MedStar Healthsystem's system nursing initiative, and niche became one of my signature programs that we utilized to implement evidence to practice. I think one of the things I love about niche is that it offers unique leadership roles for nurses in organizations to lead from the bedside, and also really in terms of frontline leadership positions. APRNs were really the first niche coordinators. And that, much like Sandy, your role as a nurse practitioner, as well as others who had clinical nurse subspecialties, and and that role continues in niche today. And so we know a number of the GAPNA members are also working to implement niche in their own hospitals. So I think that part of the APRN practice of niche has been very attractive to me, and it's been great to have a collegial group of other APRNs to discuss practice. We just launched our niche coordinator community Google group, and that's really been exciting the last few weeks to see APRNs and various, who are niche coordinators in various hospitals network with one another around practice improvement. So I think there's a great fit between niche and APRN practice, and it's been really, really valuable to me.
I think one of the things that I'd love to see is the clinical nurse specialist advanced practice role be elevated more in GAPNA. We know that we practice best evidence-based care for our older adults across the continuum, but particularly in acute care is one of the most dangerous places for our population to be. Do you have anything specific that you can recall? I know that you led your organization to exemplar status and got involved at the very early level on age-friendly care. But what is one of those signature projects that you really hang your hat on?
I think many of your members know, but let me share. Niche has a practice model that has 4 components. One is the classic role of the geriatric resource nurse, which is a change agent role with an accompanying role of the geriatric patient care associate or geriatric CNA, so that those leaders at the front of care are the ones influencing care, have the knowledge, and can do that on a 24/7, 365 basis. And so we also look at our practice protocols, which were developed by Dr. Terry Fulmer, which is now a textbook in its 6th edition, soon to be 7th, evidence-based geriatric nursing protocols for best practice. We work to implement those practices so that patients receive the standard of care, optimal care at every encounter in terms of older adult care. We also have focus around transitions of care and also the physical and the unit milieu, using the ACE principles in practice, acute care for elders principles and practices. In terms of our signature work, we also have, niche is also a quality improvement program. We have 3 levels of recognition: member, senior friendly, and exemplar. And much like any other quality improvement program, there are attributes for each level in terms of achievement. And so when I started the work implementing niche in 10 hospitals at once, I did look to those standards, to those attributes. They're evidence-based, they're aligned along 8 dimensions of care, things like organizational structures that support nurses, geriatric staff competence, interprofessional practice. But we were able to really bring all of those hospital coordinators. We also always had a partnership with a nursing professional development specialist at each hospital. And we also engaged GRNs, geriatric resource nurses, together at a system level in our system steering committee. And together we looked at the attributes. We also then developed collaborative clinical improvement projects. One of those was a project that we called the Roadrunner Project, that was based on a niche webinar that one of our nurse leaders saw and said, we should do this. We're going to do it on my unit. And when I rounded with her, I said, well, we're going to do this at every hospital. And so that was a really rewarding project. We developed a evidence of practice project. We had the GRNs doing data collection, prevalence data around how many patients were mobilized, how many patients were out of bed every day. And then they worked to implement workflow processes to make sure everybody knew their role in mobility. And then we measured our data posts and saw really quite dramatic improvements. That then, though, it was interesting, the pandemic hit. But all of a sudden, somewhere in the pandemic, it became really important that patients don't decondition, right? Because the number of post-acute care beds really bottomed out. And so I think part of the rewarding part was in the middle of the pandemic when, the physicians and the administrators were saying, oh my golly, we're going to have to figure out how to mobilize patients. The niche leader said, oh, we know, it's called the Roadrunner Project. Let's just make sure we're focused on it and get it. And so that was really rewarding to see, we did several implementations to reinforce the project. We got geriatric resource nurses, frontline nurse managers, clinical nurse specialists, all involved in the project. And then when the time came when it was profoundly needed, they were already prepared. And so I thought that was one really exceptional piece of work that we were able to do. Another was we did our geriatric institutional assessment survey for all 10 hospitals at once. And in that, we identified that there was a common theme around geriatric pain management. And so we brought in an external speaker for all the GRNs and had a conference on geriatric pain management. And then we developed, the GRNs worked together to implement education and on geriatric pain management on their unit. And we gathered those data and with two leaders from niche. One was our GRN, who then I'll give you a little postscript in a minute. And one was one of our niche coordinators. We then were able to present that work at a national meeting on pain management. But one of the other joys is seeing where those two people's careers headed. And so one went on to do her doctoral work in niche, and she's now a niche coordinator. Our GRN is now a niche coordinator in Exemplar Hospital. And the other went on to become a nurse practitioner, and she just emailed me recently around letting me know she was applying for the VA fellowship in geriatric as a geriatric nurse practitioner. And so it's been rewarding to see, both the clinical outcomes, but also the real enhancement of people's interest in the status of geriatrics as a career-worthy destination, and also as a way they saw themselves enabled for career growth because they were able to experience, their own success in implementing the program and learn some skills. So all of those things for me were really rewarding.
It's nice to hear a positive story to come out of the pandemic, that so many of our older adults really suffered during the pandemic. So that's a very positive story about, and don't we all know that mobility, as simple as that is a foundation to preventing other geriatric syndromes. So that's quite a wonderful story.
One of our leadership training, we had several mobility presentations from our leadership training program. There are new niche members that do a 15-month executive level entry to the program. And we were hearing phenomenal outcomes, 50% in falls reductions, decreases in pressure injuries. And that was just yesterday. But yeah, my philosophy is mobility cures a lot, right? Or prevents a lot. But it was interesting. We had a discussion yesterday. This one presentation was done by a clinical nurse, was phenomenal. But I said, it's really helpful to see your data because we all know that it's supposed to be like that, but the data helps you really believe in it. And that was their experience in sharing and understanding the data and doing that work around implementing mobility. They really saw such improvement in clinical outcomes that the staff really were very excited and became hardwired pretty quickly at that organization. So yes, it's really exciting to be part of this work.
That's good positive feedback related to that. When we think about your experiences in enterprise spread, you have a lot to offer growing healthcare systems because many individual hospitals are now becoming systems. And, I can certainly see a book in your future related to, system spread of innovations. You have a lot to offer in that regard. Is there anything about geriatric care that really weighs heavy on you and keeps you up at night?
I think the geriatric workforce is what keeps me up at night in the sense of we know the right things to do, right? We know mobility. We know, all the right interventions for pressure injury prevention, right? I think those things can be done, but they can only be done if we have a geriatric workforce that's engaged and excited about the practice. I think the other thing that, we're working on at niche. So one of our focus areas is to reignite that, GRN and grow that geriatric resource nurse role in many, many more hospitals. Currently, we're in about 5% of all acute care hospitals in the US. We also have hospitals, amazing hospitals in Singapore, Canada, and Bermuda, and even considering other international destinations for niche. But in terms of the geriatric workforce, it's those GRNs, that frontline knowledge that really we have an opportunity to focus on, but also that mid-level leader, not in the sense of mid-level practice, but in terms of that frontline nursing leader, either in unit operations, unit directors, clinical nurse specialists, nursing professional development specialists, quality nurse specialists, really having them be empowered in terms of their own leadership practice. So I think in terms of niche, that leadership training program is a powerful way to also help that frontline nurse leader develop the skills and ability to lead units and work with GRNs and have these best practices implemented. Obviously, the other things that keep us up, at night are finding that right amount of care for patients, right? And having thoughtful approaches. I've had 10 years in an interventional focused area, right? And so we know that hospitals are built for interventions, right? In terms of hospitals, you tend to be admitted and you always seem to end up with a procedure. And sometimes that's the perfect thing for the older adult, but sometimes we need to take a pause. I recall one of our niche steering committees at our academic medical center. We had our gerontologist who was there, and we brought case reviews to the niche steering committee. And that was one of our findings, right? Is that there was a patient, older adult in his 90s, that was in hospice, but survived too long and was disenrolled, and then came in with a sudden acute crisis. It wasn't really predictable. And, our outcome could have been better if people would have said, wait a minute, this is an older adult. Let's just take 2 seconds and look at this situation, because hospitals are built to cure. And sometimes the cure is good, but sometimes the cure actually diminishes that person's quality of life, or maybe has mortality that isn't, so it isn't a benefit. So it's making sure that people become thoughtful and reflective in clinical practice again. I think that's, the thing that keeps me up at night. I was speaking with a national physician leader in the ACE unit movement, and we were talking about, that the world is now refocused into a task orientation, particularly at the clinical nurse level, but at other levels as well. And so it's the opportunity to bring back that reflection and action to say, well, let's think about this. This is an older adult. They have this acute care crisis. What's the best outcome for the patient, which is obviously what Dr. Terry Fulmer's, who innovated niche, is also innovating at the age-friendly Healthsystem initiative with the Institute for Healthcare Improvement, that whole idea of what matters. But it's that idea around moving from a task orientation back to some more reflection and action, because AI can do a lot, but it can't do that pause and reflect, at least not at this point. So I think that's the thing that keeps me up at night, is how do we move forward to develop excellence in a workforce that's largely turned over. It's a huge opportunity. And I think, niche has a lot of, and other programs. We're not alone. There are several other programs nationally that focus in on how do you get clinical nurses at the bedside and frontline leaders to refocus on bringing evidence to practice with positive outcomes. But we have a significant role to play there, as do all the GAPNA members in terms of their work in their departments and units or their service lines around collaborating with the nurses at the bedside, with the organizational leaders in terms of enhancing, quality of care and quality of outcomes.
When you think about you're seeking your MBA, and I know on a variety of levels, it always comes down to, the so what, show me. And like you said, with the nurses looking at data and, changing their perception, how do you speak to improving the workforce, making them geriatric experts? How do you communicate that return on investment to organizations?
Yeah, we had a great webinar from one of the leadership training program graduates in the past year. This last week, they presented nationally. And in their one community hospital, implementation of niche on several units, even including the niche membership costs, the leadership training program costs, the time allocated for nurses to complete education and be involved in projects, the cost savings, even when you subtract the upfront cost to onboard niche, were $600,000. And so that's one example. I was talking to a hospital on the West Coast yesterday where the nurse leader said, with one case, I implemented a program around improving bedtime and sleep regimens for all our older adult patients. And she has a team that literally is coming in every night. She has volunteers come in from the leaders, and they're implementing this program. And she said, with one patient who on her first day had a prolonged, challenging course of illness due to delirium, had to return for a surgery, and her second surgery with this initiative to make sure she was getting adequate sleep, she did not develop delirium. And that was probably over $40,000 cost saving on one case in terms of, cost to the hospital and the patient. And so we have a return on investment tool in our niche program that nurses can use to do these calculations. It's based on the Agency for Healthcare Research and Quality findings around, what costs for things like pressure injury or central line infection, catheter-associated urinary tract infection, or a fall. And so we do monetize it. I'd like to continue to do more. We also see, for example, with mobility, you can see decreases in length of stay because fewer patients need to wait for subacute because they don't decondition. But we're still working more. That's still one of my goals, is to further monetize the projects, and we're working diligently. But it's a pretty simple return on investment, but it's equipping nurses, and it's also empowering nurses. Nurses, niche is Nurses Improving Care for Health System Elders. Niche is an organization that positions nurses in leadership, particularly in hospitals where there's not a geriatric service line. When I worked with our systems TNO, Dr. Maureen McCausland, that was her reason to bring niche to our health system, because we had geriatric service lines in 2 of 10 hospitals, but the other 10 still had lots of geriatrics patients. And so these niche leaders become really the voice of patient quality for older adults in a lot of their hospitals, and they're the influencers. But one of the things it does, and which is really fun to work with our leadership training program participants, is to talk to them about, you have a voice at the table. You should be going to your finance team. You are entitled to have help from them to help you monetize these projects. And so we're starting to see that empowerment really occur, which is another thing that obviously I'm passionate about, because I do see it positions nurses differently as being, stakeholders at the table who know how to improve care and who are worthy of having the right data, the right finance data, the right quality data in order to do their work. So I think it's easy to monetize it, but we're continuing to work in that area.
And that's a huge selling point when you look at the individual demographics. I know that was one of the key pieces for me, that, yes, we have some older people, but when we actually looked at our admissions and the age, and we saw that 49% throughout our center, they were 65 and over, and a vulnerable population. Well, that sort of, helped, define that focus. So this is a piece that uses a lot of resources within the healthcare system. And if we can reduce those complications, get them out of the hospital, reduce those readmissions, and it takes the expert nursing care, to be able to provide that. Do you have any additional items you want to share? You said that you are, I know that you're brand new in your current role as director, but have been with Niche, and I think you probably bleed purple and teal.
I do. So 3 initiatives we're working on, and if there are other GAPNA members that are interested, please feel free. Our website is nicheprogram.org. My face is there, and you can reach us just by emailing support@nicheprogram.org. But 3 initiatives. One is to engage the niche community to guide and participate in the activities of the National Program Office. We recently launched the Niche Coordinator Google group that's essentially a listserv, so that the leaders, many of them who are APRNs, are able to reach out to one another about best practices. Or, for example, there was a discussion around how do I stand up a geriatric consult service at my hospital. And they were, they're amazing leaders that are so generous. And one of them, was Dr. Denise Krusovec out at, the VA, who's amazing, who said, oh yeah, I'll help you. So we have an amazing community. We want to tap that community. We like to feature the successful implementation of the niche practice model and evidence-based practice. So we have webinars that we solicit, but also are open to having proposals for webinars, particularly from our niche member hospitals. And then we'll be doing some focus groups and other committees that I'll be reaching out to the membership for. The second is really to foster implementation of the niche practice model and disseminate our outcomes in publications and presentations. When I met with Dr. Fulmer at the John A. Hartford Foundation, her word of advice was to publish more. And so I know we've all been super busy in the pandemic, but my goal is to understand what's being published and to also support those in the niche community who want to publish their outcomes. Also, lastly, to expand our partnerships with both quality organizations, professional organizations such as GAPNA. Niche currently collaborates with the Institute for Healthcare Improvement, John A. Hartford Foundation, Age-Friendly Health System Movement, the American College of Surgeons, 4M's Geriatric Assessment Model, and the Geriatric Surgical Verification Program, American College of Emergency Physicians, Geriatric ED Accreditation, and the Geriatric ED Collaborative, as well as the American Geriatric Society Co-Care Health Program, and I'm also working as a dissemination partner with Dr. Sharon Inui's Help Enhanced trial. We also are collaborating with UCLA's Dementia and Alzheimer's Care Program, the American Delirium Society, and the Alzheimer's Association. So my goal is to be very collaborative in those programs, to share resources freely, to partner well. And because, for example, often hospitals, as they go to implement the geriatric ED program, want to engage niche for the practice model, because the geriatric ED model really overlays exactly to the niche practice model. We had a partnership group from UCSD, their physician leaders, and their, they call it a genie nurse, their nurse champion. We had a great webinar from them. They do an amazing job. And they shared the model, and I'm like, well, yeah, they pretty much match up. So niche overlays with other quality programs very nicely, and they overlay with us very nicely. And so I think that's one of the other areas that we're going to continue to expand in. We're also partnering very closely with our colleagues, our sister partner organization at NYU Meyers College of Nursing, the Hartford Institute for Geriatric Nursing. I was just on a meeting today with Dr. Tara Cortez, who's the executive director of HIGN. And so we're continuing to partner with them. They have a number of amazing resources, initiatives going on. So lots of partnerships ahead for us. It's really exciting time to be part of this. I believe, niche is one of the many ways forward in terms of growing practice, optimizing practice, being very forward thinking in practice. So those are the things on my mind right now. So I'm excited to be part of it.
Is there any plan? I know that before the pandemic, there were plans for outreach into some long-term care facilities. And, is that, a future opportunity? Because we know that workforce has had lots of challenges.
We definitely have a number of organizations that are long-term care and PACE sites, and we continue to work closely with them. Yeah, I'm looking for the sweet spot, because Hartford Institute for Geriatric Nursing, as well as Dr. Ab Brody's work with the Alleviato program with dementia care, are very, very active in those hospitals. So looking ahead, we're going to look for the overlays and the ways we can synergize together around long-term care. But yes, niche absolutely belongs in long-term care, and we want to make sure we're continuing have those partnerships well.
And many of our members do work in long-term care and would certainly be, wonderful resources to growing that direct care expertise.
That's a great idea. That might be a potential GAPNA niche HIGN opportunity, right? To collaborate on that. That's awesome.
And, looking at, some of our special interest groups, around dementia and Alzheimer's and maybe making some connections. Even we have an acute care special interest group that, trying to grow, and you would be the perfect fit to be involved in that special interest group. So you can go explore, and like you have nothing else to do on your, on your plate. So
yeah, we've launched SIGs in the past, but I think this might be as I look at the quality partnerships and what you just mentioned, I think there are potential special interest groups within niche as well that could collaborate. I just haven't stood those up yet. It's still early days, but I think that is also a potential partnership.
Well, that is wonderful. I am so grateful to have you as a colleague and a friend, and enjoyed our conversations. And really, this is an empowering future for nursing and the care of the older adult. So thank you again, Dr. Mack, for chatting with us today. And for all of you, until next time, as you take care of others, remember to care for yourself. Thank you.
GAPNA Chat is owned and produced by the Gerontological Advanced Practice Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. If you are an advanced practice nurse caring for older adults and want to further your career, GAPNA encourages you to sit for the Gerontological Specialist Certified exam and earn your GSC credential. This expert certification distinguishes APRNs with the knowledge and experience to manage the complex health needs of older adults. Visit gerocert.org to learn more. Dr. Karen Mack is the Executive Director at Nurses Improving Care for Healthsystem Elders at Rory Meyers College of Nursing at New York University in New York, New York. Dr. Cassandra Von S. is the Nurses Improving Care for Healthsystem Elders Niche Coordinator, Geriatric Oncology at the Moffitt Cancer Center in Tampa, Florida. She is a member of the Gerontological Advanced Practice Nurses Association communication team and is a host of the GAPNA Chat podcast series. For archived episodes of GAPNA Chat and to learn more about the Gerontological Advanced Practice Nurses Association, visit gapna.org. You can also subscribe to GAPNA Chat everywhere podcasts are found.